Oh, okay. Stand on the X, huh? All right. I'm my hero. Let's go. Right there. I'm my hero. Hello, how you doing? All right, let's get started. Let me say good afternoon, and let me thank everyone for joining us today. I want to welcome Dr. Mark Callender, the president of Memorial Hermann Hospital, who is with us today, and he'll be speaking immediately after myself. And then Dr. David Persse, the chief medical officer for the city of Houston, Chief Pena with the fire department, David Martin, the mayor pro tem, Carlos Cisneros, the council member of District H. As we get closer to Thanksgiving Day and the holiday season, and people start to think about Christmas, Hanukkah, and other holiday celebrations, we think it is important to use our collective voices and send a clear message about the health and safety of people in our city. We want to provide some additional guidance on how you can protect yourself and your loved ones and friends from the COVID-19 virus. And let me just say, we've been having these conversations for the last 8 months. We've gone through one phase, and then as you know, what took place over June, July, and August, how the numbers really increased. Positivity rate was very, very high. Then the numbers started coming down in September, October, and now we are seeing a resurgence all across the country, even in West Texas, and we want to do everything possible to keep this virus in a manageable state in the city of Houston, and certainly until such time as vaccines become available. And the reason being is that the Houston positivity rate continues to creep up. 5 weeks ago, the positivity rate, we had gotten it down to 5%. The goal really was to crush it, to get it below 5%. Then the numbers started to creep up. So we've gone from 5.6 to 6.5, 6.7, 6.9. Today, the positivity rate for this week is now 7.9. So you see, we are moving in the wrong direction, in the opposite direction that we intend. The increasing positivity rate, the daily new cases, and the hospitalizations are clearly a dangerous trend in the wrong direction, and we want to reverse course. Today, the Houston Health Department is reporting 141 new cases of COVID-19, bringing Houston's total to 90,239. There are 2 newly reported deaths, bringing the city's total to 1,398. The 2 newly reported deaths are on your screen, and they include a Hispanic male between the ages of 50 and 59, and a Hispanic male between the ages of 60 and 69, both with underlying health conditions. As the holidays approach, traditional large gatherings with extended family members and friends are simply not safe at all this year. I want to repeat that as we approach the holiday season. Thanksgiving is right upon us. These traditional gatherings where we invite people into our homes, we have large gatherings, friends, you name it, it's not the way to proceed. This year, we want that message to be loud and clear. This virus thrives on gatherings and will take advantage of holiday festivities to sicken our loved ones and further spread within our community. We strongly urge, in a very respectful manner, we strongly urge everyone to limit in-person holiday gatherings to household members only, to slow the spread of COVID-19. People who attend a holiday gathering with people who don't live in their home need to consider avoiding non-household members for 14 days before and after the event. And although the holidays will look and feel different this year, making smart choices could save the lives of the people you deeply love. Use caution when it comes to holiday travel. And I want to underscore this because we know during the holiday season, just before Thanksgiving, a lot of people traditionally will travel from one location to another. I want to encourage you to avoid going into areas with high community spread in other parts of the country, even in West Texas. And I want you to be mindful that people, your guests, your relatives, for example, who may travel from other parts of the country where the outbreak is pretty much running rampant, far greater than what exists in our city. If they are coming from those areas into the city of Houston, into your home, that simply would not be advisable right now. And then I want to caution Houstonians who are thinking about traveling outside of the city of Houston to areas where the virus is rampantly spreading, much, much higher than what exists in the city of Houston, and then you plan to return. This year, and especially at this time, I certainly would caution you in making those travel arrangements and encouraging others from outside of the city to be coming into the city, into your home. But the understanding is clear, and what we do know is that the wearing of masks do work. They do work. And when 95, let's say, % of the people in our city, when they are wearing these masks, they do work, and they prevent mitigate the spread of this virus to someone else, of the virus coming from someone else to you. As a result, the wearing of masks in Houston is mandatory. And let me underscore that. The wearing of masks in the city of Houston is mandatory. And if after getting an initial warning, you are subject to a $250 fine. So let me underscore it. Nobody wants to give you a citation. No one wants to fine you. But the wearing of masks in the city of Houston is mandatory. And I would ask you to please comply with that. We prefer to warn people only, but we are at the point that we need to be more forceful in our messages and help people to understand the danger in which they are putting themselves and everyone else in this city when they do not wear a mask. Out of concern and an abundance of caution, we made the decision to reimagine the city's Thanksgiving Day celebration this year. Every year, the HEB Thanksgiving Day draws thousands of people downtown for the Thanksgiving Day parade. But this year, it could become a super spreader event, and we do not want this holiday parade to contribute to the spread of the virus. And due to COVID-19, the mayor's office, along with HEB and other sponsors, will instead host the HEB Family Thanksgiving Food Distribution. So instead of the parade, it will be the HEB Family Thanksgiving Food Distribution. It will take place this Saturday, November 21st, from 8 a.m. to 2 p.m. At the NRG. And it will be from 8 to 2 until the turkey and the ham and all the other supplies run out. The distribution will include groceries for preparing your own Thanksgiving feast. And so we will encourage families who find themselves in need to come out to the HEB Family Thanksgiving Food Distribution this coming Saturday from 8 to 2 until food runs out. I know it's difficult to celebrate without all of our family and friends, but we must stop this virus. Quite frankly, we must blunt the positivity rate, the increase, and start working to bring that down. And we need everyone's help. I'll close with this. Remember, don't invite COVID for Thanksgiving dinner, okay? You want the turkey, the ham, all of the trimmings. But what you don't want is to invite COVID to your Thanksgiving dinner. So leave COVID on the outside And in so doing, we will all live to enjoy another day and another year. Having said that, let me now pause and bring up Dr. Callender for his remarks.
Well, thank you, Mr. Mayor. And I join with healthcare providers from across this city and across this region asking that we all abide by the mayor's recommendations, these guidelines that have been established, and that we know can help us limit, even stop the spread of this terrible disease. Now, we know we're at a time of higher risk, just related to the weather being cooler. We tend to spend more time indoors, and so that puts us at higher risk for transmitting and getting the infection. If we follow these guidelines, the 3 W's, wearing masks, washing our hands, and watching our distances, we can markedly reduce the risk and stop COVID-19. Now, as the mayor suggested, we can celebrate our holidays safely. Certainly the safest way is to celebrate in our own homes with members of our own household, but we also can be creative. We can use these marvelous technologies that are available to us now to celebrate virtually with members of our family outside of our household and friends. We can talk about the things that we're thankful for. We can talk about our friendships, our relationships. And if we do come together, we encourage that we do that in groups at 10 or smaller in number, and to the extent that it's possible, do so outside and use the 3 W's to protect ourselves. We all have been through a period of time here when we saw the very negative impact of having high numbers of COVID-19 cases. We saw the impact, the negative impact on health and well-being. We saw the negative economic impact that still is affecting our city and our region. We can avoid that. We can stop this surge which seems to be building if we follow the mayor's advice and abide by the 3 W's. Thank you.
Thank you, Dr. Callender. Now let me call on Dr. Persse.
Thank you, Mayor. Thank you, Dr. Callender, for coming and joining us today. When we look at the cases in Houston, and I think we got a graph we're going to bring up. We've noticed that in July we had a pretty high surge. And you've been seeing on the news that we've been hearing about how the numbers have been trending across the state. So this graph shows the numbers of COVID cases here in Houston. And I want to draw your attention to 2 things. First of all, if you look at how high that spike was in July, and let us remember the impact that that had on the economy and the hospitals. And the hospitals had high percentages of people who were admitted to the hospital at that time with COVID disease, which you have to remember, heart attacks, new births, other illnesses continue to occur. Health continues to occur, and people need those hospital beds. So it put a real bind on the hospitals, but it wasn't just the folks with COVID in the hospital that we need to think about. It's everyone else, because hospitals don't run with 50% occupancy. They run pretty full all year long, right? So we did a great job, and look at how steep that curve goes down. And we were able to get it down very low in September and through October. But here in November, if you look to the right side of that graph, you'll see that those numbers are starting to creep up just as we are entering the holiday season. And all the things both the mayor and Dr. Callender said about family gatherings will make that a potential bad combination. And I want to get back to the hospitals, because remember, we're hearing a lot of folks talk about how it's younger people who are becoming ill and they don't require hospitals, and that's true. The other thing that's happened is the hospitals and the physicians and nurses have gained skill and expertise in taking care of hospitalized COVID patients, and we're doing better and better with that. But if you look at this graph here, this shows for our region the percent of hospitalized patients who are experiencing COVID and are diagnosed with COVID disease, and you'll see it's at 8.8%. And I will tell you, whether it's on the screen, that I know that just 6 days ago, it was about 6.4%. So the graph to the blue and red lines on the bottom there, the scale makes it difficult to appreciate, but the numbers of hospitalized patients are starting to creep up again. But again, I want to remind folks, we crushed this virus. Well, we nearly crushed it. We pushed this virus way down and into a corner once before, in fact, twice before, but we certainly can do it again. And then finally, in the last slide, this is what's going on across the state. And with that blue chart, you'll see this is the hospitalizations across the state. And you can see that peak back about 4 or 5 months ago, but you'll also see how the numbers on the right side are going up. And I want you to think about the graph that we just showed you of Houston, which is dramatically different because our curve looks nowhere near as bad as this curve. So that means that we have time. We've got the experience. We know what to do. We've done it before. This community has done it before. Follow the advice that's been given. Wear the mask. Wash your hands. Avoid large gatherings. And then one other thing I want to remind people, a really important part of our strategy to protect ourselves is that for those folks who are ill or who have tested positive, you need to isolate. And we recognize that that is hard to do, especially if you don't feel terribly ill. But isolation means you stay away from other folks, and it's predominantly your family members. No, you don't go to work. And no, you stay in your room at home and have your meals brought to you until 10 days passes and you've not had fever for over 24 hours and your other symptoms are improving. Or if you're a family member who needs to be in quarantine, you actually have to quarantine. Because remember, 40% of people who are infected have no symptoms, and so they don't feel badly, and so they could be unknowingly infected and spreading the virus to even more folks if they go to work, if they go to church, if they go to the grocery store, if they go to any place where they could come across and be close to other people. So isolation and quarantine, especially for those who don't feel terribly sick or have no symptoms at all, yes, it's difficult. But those are the sorts of things that we in this community need to double down and do so that we can repeat our excellent performance a couple months ago and drive these numbers back down so that we protect our family members. Remember, the person you're most likely to infect is a member of your own family. So when you follow these rules, you're protecting your family, number one, and the community needs that help too. Mayor, thank you.
Thank you, Dr. Persse. And let me call on Chief Pinion. I'm going to ask him to give his report in English and also to provide the additional comments in Spanish.
Thank you, Mayor. Thank you, Doctor. Thank you and your team for being here and joining us today. Really quickly, I'm going to run down the fire department's numbers, and then I will relay the mayor's message in Spanish. So for the fire department today, our numbers have been following the trends like the city has. They're going up a little bit. 2 weeks ago, we were at 60 firefighters in quarantine. Today, we are at 100 firefighters in quarantine. We have 30 currently that have tested positive for coronavirus. In total, we've had 317 that have tested positive. 287 of those have returned to work. We don't have any firefighters that are in the hospital at this moment, and we hope to keep it that way. We are continuing to provide our firefighters with the equipment and the tools that they need to safely serve this community. En español les voy a pasar el mensaje que dio el alcalde Turner acerca del número de coronavirus en esta comunidad y las recomendaciones que les estamos dando a nuestra comunidad para asegurar su seguridad en estos tiempos de acción de fiesta y esta temporada navideña. Debido al número de casos que tenemos en esta ciudad del coronavirus, que está aumentando, lo que nosotros recomendamos es que en estos días, en esta temporada navideña, en estos días de acción de gracia, que limiten el número de personas que estén en su casa a un grupo chico, ¿sí? Si pueden limitar las personas, nomás los familiares más cercanos, para poder evitar la transmisión del coronavirus. Nosotros sabemos que en grupos grandes el virus puede pasar de una persona a otra fácilmente, y queremos evitar que los números de coronavirus sigan aumentando en esta comunidad. Hoy está el número de personas positivas acerca del coronavirus en la comunidad, en la ciudad de Houston, en el 7.9%. Eso ha aumentado en septiembre, que estábamos un poco abajo del 5% en esta comunidad, y ha aumentado casi 3 puntos en este mes y medio. Ha habido también 2 muertes hoy que se reportan nuevas. Fueron 2 personas hispanas, uno en sus años 50 y otro de 60 años más o menos. Esto sube el total de muertes en la ciudad de Houston a 1,398 muertes que han ocurrido desde que empezó esta pandemia. El segundo mensaje que quiere pasar el alcalde Turner es que si van a viajar en otros lugares aquí en Texas o en otras partes del país, que tengan precaución. La recomendación es que si no tienen que viajar, que se mantengan en casa, y si esperan familiares, también que tengan precaución, porque especialmente si vienen de otras partes donde están los números de coronavirus más altos, en el oeste de Texas, en otras partes del país, que están los números elevados, que tengan mucha precaución y que no inviten al coronavirus a su cena de acción de gracias. Este año no va a haber el desfile de acción de gracias, por también precaución de no tener grupos grandes. Lo que se va a hacer entonces va a ser una distribución de comida, de todos los preparativos para una cena de acción de gracias, y eso va a ser el sábado en el NRG, sábado 21 de noviembre, de las 8 a las 2 de la tarde, hasta que duren la comida. Van a dar pavo y todo lo que se requiere para poder preparar una cena de acción de gracias. Y quiero repetir, eso va a ocurrir este sábado, el 21 de noviembre, de las horas de las 8 de la mañana hasta las 2 de la tarde. Thank you.
Thank you, Chief. And then just two additional things. Number one, there are plenty of testing sites throughout the city of Houston. No cost, no charge. Please, please get tested, okay? So if you got tested, for example, a month ago, it's time to get tested again. If you've been around large gatherings, especially around people who didn't have their masks on, it's time to get tested. So please get tested. Do that for yourself and for your family members. The second thing, bear in mind, flu season, so please get your flu shot, okay? You don't want to compound the two, so please get your flu shot, and then and at the same time, get tested. If you do those two things, then that will help us out as well. We'll take questions now from to anyone who's present up here.
I have the pool questions here from KHOU. The first two are for Dr. Persse. So in the past 3 days, most of the newly reported cases have specimen dates within the last 14 days. What is that telling you about the virus's current spread?
So the positive cases that are come through the last 14 days is really more a reflection of the better job the labs are doing of getting us the information. You may recall that for a while there we had an issue with labs getting positive reports but not getting them to us in a timely fashion, and so we've been working with them. And so that increasing percentage of cases that are getting to us within 14 days, making them actually within 10 days, is beneficial. Now, it's a little bit hard because when you look at those numbers, you don't know from that statistic, you don't know when they were done. Now, that's where we had the graph earlier that sort of showed. And I don't know if we can put that up again, but the one graph that showed that the number of people going and getting tested is increasing. So that's good because that means that we have the positivity rate that we get is probably much more reliable. And so we're now, it's gone up to the 7.9%, but as more and more people get tested, there's the graph right there. So you can see the number, the yellow and red bars combined reflects the number of people who have gotten tested. And you will see that since early September, the number of people going to get tested has gone back up again. Now, the other thing which this graph doesn't show is our total capacity. And during that same time, we now have even more capacity for testing. So as we start getting up towards the peak of what we saw in July, I don't want anyone to think we're going to be short on testing. We have lots and lots of capacity for testing. Now, the number of people who are testing positive, that's going up. Our positivity is going up. That's what I would expect. It's unfortunate because that's all preventable. And if we double down and redouble our efforts, we can change that and push that back in the other direction again. Time is not up. Remember, we looked at the other graph showing what's going on across the state. We're in a much better situation than the rest of the state is. But we need to work to stay there. And so as these numbers come up, it has our attention. That's one of the reasons we're here talking to you today.
This is kind of like on the same topic from KHOU as well, and kind of in regards to the comments made by Congresswoman Sheila Jackson-Lee for you, Dr. Persse. She mentioned that she wanted to see public safety alerts sent to people's phones to boost the testing here in Texas. Do you feel enough people are currently getting tested, and is this accurate, again, with the positivity rate and other data?
So anything we can do to get people to go and get tested is a benefit, and however we choose to notify them or encourage them is fine by me. Remember, in a perfect world, everyone would get tested, probably realistically, everyone would get tested about every two weeks or so. There's a 14-day incubation period. It's impossible to expect people to get tested weekly, but probably every 2 weeks would be a good way. Because remember, we're challenged with the fact that 40% of people who are infected have no symptoms, have no idea that they're infected, and are simultaneously spreading the virus. The only way those individuals would know that they were spreading the virus and then able to take action would be if they got tested. So the more people who get tested and the more frequently that we as individuals go to get tested, the more empowered we are as individuals to not only protect ourselves, but also to protect our family members and our coworkers and our neighbors.
Thank you, Dr. Persse. The next questions are from Fox 26 for the mayor. And this is I think you mentioned this earlier, but for people traveling for the holidays, what do you recommend, and should they get tested now and quarantine now?
Well, certainly if they're traveling, I would recommend they get tested before they travel, okay? And quite frankly, I would recommend that they start to separate themselves from large gatherings about 2 weeks before, and probably about 2 weeks after. But I would certainly recommend that they get tested before, and then I would recommend that they get tested after the fact as well. I would also recommend that people try to minimize their traveling, like I indicated earlier. If you are leaving the city of Houston, for example, and if you're going to places where we know that the positivity rate is high and there's a great deal of community spread, let's say more than what exists here in the city of Houston, I would recommend that you kind of reconsider that. And for people who are, if you are having people coming from these other areas where the positivity rate and community spread are much higher than exists in the city of Houston, I would also recommend that you encourage them to kind of stay put at the moment. So, you know, the phrase that I'm using, don't invite COVID for Thanksgiving dinner, you know, that is not a meal that you want because it doesn't leave you too soon, okay? So that would be my advice. I know it's rough. I know how we want people, family members and friends to be around us, but this is not the time.
Thank you, Mayor. The next two questions are for Dr. Callender. How is the effectiveness of a vaccine determined? Where do we get these 90 and 95% numbers, and what do they mean?
The effectiveness of a vaccine is confirmed in a clinical trial. And so the two vaccines that you've heard about recently, the one from Moderna and the one from Pfizer, are in the final phases of the third phase of the clinical trial. During the course of a clinical trial, there's an independent group of scientists who typically get together at specified points in the trial. And they look to see what's happening to make sure things are going as they should. In particular, there's no additional risk for people participating in the trial. What we heard from the Pfizer and the Moderna groups was the reporting from that first endpoint, where a certain number of people who had received either the vaccine or the placebo, the sugar water, if you will, had developed infection. And so what the board did, this independent board, is to look at the people who had infection and determine whether or not they were vaccinated with the vaccine or they received placebo. And so the calculations, the early calculations of effectiveness, are based on that first endpoint. Hopefully, we're all hopeful that those rates of effectiveness will hold up, but there's certainly a possibility that they could fall over the course of time. We need to wait until the end of the clinical trials when there's another full independent review that will help us determine whether vaccines are actually safe and effective. And the FDA can look and determine whether or not it provides authorization for use, whether it proceeds with full authorization. The bottom line is, with both vaccines, we're encouraged, but we have a way to go before we truly know that they will be safe and effective and okay to administer.
I mean, I think you kind of touched on all these questions that they have up here next, but the virus mutates like some people think it has. Will the vaccines need to be updated over time, or is this a vaccine that we only do once and it's done and over with?
Possibly. I mean, certainly we know that viruses do what we call have genetic drift, which means that their genetic makeup changes over the course of time. Thus far, we haven't seen a large amount of genetic drift with this SARS-CoV-2 virus. And so again, we're hopeful that the vaccines, the methods being used to produce them, will allow us to have a longer period of effectiveness. Now, again, we don't know that yet, but we're hopeful. The other good news is that these two vaccines that you've heard about are what are called mRNA vaccines. I won't go into the science of that, but we have other forms of vaccines which are also being developed. And so actually having several different types of vaccines may also help us overcome any potential negative from genetic drift.
Thank you, Dr. Callender. Just one more in Spanish from you, Dr. Peña, or Chief Peña, if you don't mind. Talk to us about the message, el mensaje para la comunidad latina. Sabemos que es una comunidad que, pues, comúnmente es conocida por juntarse para celebrar en familia ahora que vienen los días festivos. ¿Cuál es su mensaje?
Sí, pues mire, el mensaje es como ha recomendado el alcalde y los doctores y los expertos, que si pueden limitar el número de personas que se congreguen en un lugar, que es mejor. ¿Sí? Si pueden limitar ese número a nomás los familiares inmediatos y que estén en el hogar, es la recomendación mejor que tenemos, porque sabemos que este virus sí se transmite de una persona a otra muy fácilmente, especialmente si están esperando a familiares de otras partes del país o del estado, que tengan precaución y que recomendamos que se hagan las pruebas del coronavirus, que son gratuitas, antes de juntarse y congregarse en estos días festivos y especialmente para el Día de Acción de Gracias.
Thank you.
Thank you.
My question to Dr. Callender.
I was with Chief Pena until he sped up, but when he went fast, he lost me there. So,
My question to Dr. Callender. Hi, Dr. Callender, Dr. Thompson with Health and Development Magazine. You're welcome. I want to follow up with some questions which are very necessary. The first is the frontline workers and the COVID-19 vaccine. Actually, your statements have thrown a little bit of confusion in the minds of people who must have heard from the White House saying that they are already in the process of rolling out these vaccines. They were even saying that they are not going to give Como's New York vaccines, as if the vaccines are already ready for distribution. So maybe you may want to clarify a little bit on where that confusion is coming from. Because today in our meeting with the Director General of the World Health Organization, we are also looking at the issues of these vaccines, though the major scientists behind Pfizer and BioNTech, Turkish Germans who did the work, it looks like Pfizer is going to have a control over the vaccine. And the World Health it's already troubled. Are these vaccines going to be shared with the international community? Are they going to be shared with the nations that are part of the 192 countries that make up the World Health Organization? Who is going to protect what? Who is going to allow those to happen? Thank you.
Well, let me thank you very much for the questions, and certainly Dr. Persse can help relative to thoughts and comments about the plan for vaccine distribution. We know that a tremendous amount of work has gone into the planning for the delivery, the storage, administration of any vaccine that's proven to be safe and effective. We don't really know exactly which vaccine will be available first. In fact, we don't even know that there will be a vaccine available, although, again, we're certainly encouraged by this recent news. That said, when a vaccine becomes available, we want to be ready. We want to have the infrastructure in place to be able to move it about to the points where it will be administered, to safely store it. Some of these vaccines, like these two, from Pfizer and Moderna will require 2 doses, 24 to 28 days apart. And so we've been working as healthcare delivery experts with our public health officials to develop a distribution system, a storage system, and a plan for administration. And that's pretty well in place. Now, these big pharmaceutical companies that are involved in research are not just limited to the U.S. Most of them are multinational in scope, and there's been, from my perspective anyway, great collaboration around the globe, sharing information. And I know that the World Health Organization certainly is advocating that we make vaccines available all around the world. Any additional comments, Dr. Persse?
Yes, sir.
Real fast, I didn't hear a time for Saturday. What time is the Saturday time going to be?
It's from 8 until 2 p.m. or until as long as supplies last. 8 to 2.
Mayor, we wanted to talk with you about other numbers that are out there that have drawn concern. We're talking about COVID numbers and obviously the dangers behind them.
Sure.
And last week you addressed the rising numbers with regards to homicides. You were out at the shooting that took place last week. Sure.
Yeah. Hi, Mayor. Can you please tell me your thoughts on the court case that was lost in El Paso on the lockdown? Your thoughts on that?
Oh, with
Number
respect to
two,
the
are there restrictions you could consider based on that court case, considering that in light of that, if we got to that point?
Yeah, that was a court case that was brought initially against the county judge for engaging in a 2-week lockdown in El Paso County. That case went up on appeal of the appellate court stayed that lower court decision, returned it back. And it's my understanding that the county judge has elected not to take any additional legal action based on the appellate court decision. So the county judge is now standing down. Mm-hmm. Look, all of us locally, we recognize what's happening in our local jurisdictions. And whether you're a county judge or a mayor, we all want to do everything we can to blunt the progression of this virus, because we're looking at these cases are not just numbers, they are people. They are someone's husband or wife or a daughter, son, parent. These are people. And when you see the numbers rising and the number of people, for example, who are entering into the hospital system, and in El Paso's case, the number of people that are dying at a rapid rate, you feel compelled to do something. And that's one of the reasons why today and in the past several weeks, we've been raising the flag, ringing the bell to the people in the city of Houston to take note of what's happening. And just because our numbers, relatively speaking, are better than the numbers in West Texas or in other parts of the country, it could very easily be happening here. And as the mayor of the city of Houston, I saw the numbers in June, as well as we all, June, July, and August. Those were devastating numbers. We don't want to relive that. We don't want to go through that again. And we can control the progression of this virus if we individually and collectively take this virus very seriously. It's an insidious virus, and it's just not going to go away on its own. So that's why we're waving the flag. We're ringing the bell. And I'm saying to people in the city of Houston, take this seriously. When I drive through this city, for example, on weekends, and I am seeing the number of people who are hanging out in many of these businesses, and people without masks on and in one another's faces, that's a recipe for disaster. So I understand what the county judge was doing, and I understand the actions that he took. And the big city mayors in Texas have had frequent conversations about those actions that the county judge, as whether or not we supported or didn't support. But all of us recognize the severity of this virus and how insidious, and that there are many families who are without loved ones because of it. So I don't criticize them at all. I understand. So that's why I'm asking people in this city to really exercise responsible behavior for themselves and their family members. That's a long answer to your question.
Are there any specific, are there restrictions you think you could take as a city in light of the law, loss in court?
I've had my conversations with Chief Acevedo and law enforcement, and that is the wearing of this mask is mandatory in the city of Houston. If you're in the midst of other people, this is not an option. This is a requirement. And the fine, after you've been warned initially, is a $250 fine. I have instructed Chief Acevedo and HPD to recognize that and to play our part, to do our part in doing whatever we can to keep this virus in a manageable state. So we are telling people, please put on this mask. And quite frankly, I never go home without at least a couple of them. And if I'm around a lot of people, you'll not only see me with one on, you'll see me with two on. I mean, because I know for right now, this is the vaccine. This is the vaccine that I know exists that works, okay? And you all have seen me around a lot of people. And I've been very fortunate, blessed. But quite frankly, if I'm in a situation where I feel uncomfortable, I not only have one mask on, I'll have a couple of them on. Just for my own protection and to make sure that I don't carry it to people that I love. Okay? Now, Mario.
Thank you, Mayor, for the time.
Okay.
Thank you, Mayor.
Sure.
Appreciate the time. There are obviously the concerns that you just pointed out, sir, with regards to the numbers creeping up to COVID, the other numbers that in the city that are out there that people are concerned with also.
Sure.
Are the homicide numbers
Sure.
that have gone rapidly up as well this year. To the families out there who say that Houston is heading in the wrong direction, what do you say to them?
Well, I would say to them that I understand that. And the numbers are going in the wrong direction from what I would like. I don't want to see crime rise in our city at all. I want to see those numbers going down. And I look at the numbers every week. I'm looking at the crime stats, and sometimes 2 and 3 times in a week. So I don't want them going up as well. And we, of course, it is a community effort. It's not just HPD. It's all of us that have a responsibility. I mean, we have provided additional dollars for overtime. We provided additional resources to fight domestic violence. We've provided additional support resources for crisis intervention, people who are suffering from a mental behavioral health issue. All of those things we have done. We provided additional support for rental assistance, for small business economic assistance to try to address the stresses that people are experiencing in their lives. At the same time, COVID-19 is no excuse for anyone committing any sort of crime within our city. And so I would ask people, if you know of someone who intends to commit a crime or someone who has committed a crime, please provide that information to us so that we can investigate these crimes and get people off of our streets who have committed crimes. And I would ask people to be responsible. So I certainly understand that. My number one priority as the mayor of this city is protect the health and safety of the people in our city, not just from COVID, but from all these other elements as well. And so, it's not even an answer to say it's happening all over the country.
Right.
The question is right here in the city of Houston. So we're taking all available means to address it, to reduce it, and quite frankly, one crime is one crime too many.
It was back on October the 19th, I believe, sir, that you stood up here and you announced the initiative of $4.1 million of CARES Act dollars that were going to be strategically placed in 6 hot spot locations
Yes.
around the city of Houston.
Yes.
Since that time, we've identified, and just the date, let's go to last Monday. As you know, it was a very deadly day here in Houston,
Yes.
a week ago Monday.
6 homicides.
Yes. Multiple homicides in
Yes.
those hotspots.
Yes.
Do you believe the hotspot initiative is working if we're still seeing homicides inside those locations in numbers afterwards?
Well, of course, I think it's working. The reality is that you can't say, no one knows how many crimes have been prevented, okay? We only know of those that have happened and occurred. But even if it's one, if it's one homicide, it's one homicide too many. If it's one crime, burglary, it's one too many. I can't give you the answer why people do what they do. I wish I knew the answer. All I know is that committing any type of crime is wrong. And there is no justification, no COVID justification for when it occurs. And we're going to do everything we can. We're going to invest in communities and in people, in families. We're going to do everything we can to keep people with their jobs. We're going to do everything we can to provide, to retool people, to give them the skills so that they can take care of themselves and their families. We're going to do everything that we can to address people's mental issues and their stress that's in their lives, to bring that stress level down. We're going to do that. And even doing all of those things, there will still be some people that will commit crimes for whatever reason. And what I would say to you, this is a village, it's a community issue, and that all of us have a responsibility to do everything we can to keep our community, our neighborhoods, our street safe. So, that's the best answer I can do. We'll provide whatever resources and working with City Council. We'll provide every resource, every tool. We'll address people's educational needs. We'll try to equip people to give them everything they can to take care of their families. We'll do all of that. But in the end, and we will pray, okay? And then when we pray and we get up off our knees, we'll work on it. But having done all of that, at the end of the day, I cannot give you an answer of why some people do the things that they do.
And Mayor, one quick follow. You can tell it's been an exhaustive initiative. It's an exhaustive challenge. Just by hearing you, you can tell that it's a challenging situation. You say we do everything we can, but when you hear that someone's been murdered by someone who was out on bond or out on multiple bonds, what goes through your mind at that point?
Well, I mean, you don't want that to take place. And I don't think there's any judge out there that would put people out on bond if they thought that person was just going to go and commit another crime. I don't think that's the case either. Look, we are equipped with a whole lot of tools, but we are not all-knowing. That's far above my pay grade, okay? But as the mayor of the city of Houston, and I'm sure I can say this for the members of City Council, we're going to do everything within our power to protect every single person in our city, regardless of where you live. And it's something we wake up with on our minds. It's something we go to bed with on our minds. And this has been an unprecedented year. It's been an unprecedented year. But what I would say to people in this city, regardless of whatever social economic level you may find yourself, is that COVID-19 is no excuse or justification for a burglary, for an assault, for a homicide, for going out here robbing, killing, and stealing. And it is unacceptable in our city. And what I would say to people in our city, if you know of individuals who have committed these crimes, okay, it is not responsible not to provide us with the information so that we can resolve and bring closure to many of the families within our cities that are hurting. And it's one thing to be infected by COVID, okay? It's another thing to be impacted by somebody who decides to go grab some senior citizen's purse, or to assault a senior citizen, or to commit a crime against a child, or to engage in assault in a domestic violence situation, those incidents are totally unacceptable. Okay? They're unacceptable. And people ought to know better. And so we are going to provide the resources on multiple levels, not just on one. But I believe, I'm a firm believer, we'll get our arms around it, and we'll bring these numbers down. And I say that with every degree of assurance that we will tackle this issue holistically, and that these numbers, these criminal crime numbers, stats, will come down. I can't tell you when, but we're going to work on it every single day.
Mayor, since you're speaking on that issue, I just wanted to follow up. We are basically burying a police officer or a firefighter in this city now every week. We are having the funeral of riots, and I think other things are happening. Can you speak to why these officer killings are increasing and going on the way we are having them presently?
Well, number one, I mean, our law enforcement officers are out there on the front line, and they are not immune. They are human beings too. And just like Sergeant Preston was responding to a domestic violence situation. And so he was seeking to protect and serve, and was killed in the process. Sergeant Rios was on his way to work when this incident occurred. So no one is immune. No one is immune. And that's why it's so important for us to do everything that we can to protect every single person, because quite frankly, but for the grace of God, it could be any one of us. Okay? It could be any one of us. But it is no one person's responsibility to maintain the safety of our city. It is all of us. It's not HPD. It's not fire. It's all of us. We all have a responsibility. And we all have to hold ourselves accountable. So we cannot rely on 5,300 police officers to protect 2.3 million Houstonians. And that's why if you know something that's happening on your street, in your neighborhood, in your home, you too have a responsibility. And I think we have to get past where we're always looking to someone else. Yes, I'm the mayor. I accept that responsibility 100%. Don't shy away from it. But it's not just our responsibility or mine. It's all of ours. So again, we'll get our arms around it. We'll bring these numbers down. I'm very confident about that. We're going through a challenging point in time in our history of this city. But if I know Houstonians, and if I know the spirit of this city, we will overcome these challenges as well. On that, I am assured. So let me just close on this. Gobble up the turkey, but don't let the COVID gobble up you. Okay. So enjoy, have a good Thanksgiving dinner. Get the turkey and the ham. Don't bring the COVID as the dessert. Okay. Because that's one piece of pie. I started to say something, but that would probably make social media. I better leave that. No COVID pie. Leave the COVID. I think I've said enough for today. You know, the rest of this will be in Spanish. Thank you. Thank you. Thank you.